Good morning, everyone. I'm Dana Corson, and I'm a media officer with the National Academies. On behalf of the Institute of Medicine and the National Research Council, I would like to welcome you all to this briefing, those of us who are here in the room and those of us tuning in via our live webcast. This is a discussion of the new report that was just released titled Transforming the Workforce for Children Birth through Age 8, a Unifying Foundation. The report is now available, and it can be downloaded as a free PDF along with other related materials at www.iom.edu/birth-through-8. Also, the hashtag for this report, if you're on Twitter, is #birth-to-8, the number sign 8. This will be a 1-hour briefing unless we run out of questions beforehand. We'll start off with opening remarks to introduce the study and then give an overview of the report's recommendations. We'll then open it up for questions from those in the room and via the web. Those of you in the room are asked to go to our aisle microphones to ask a question. Those watching the webcast can submit questions by typing into the Q&A text box below your video viewer screen. We ask that anyone asking a question, either here in person or via the web, to identify themselves and their organization before asking your question. And with that, let me introduce Victor Zhao, President of the Institute of Medicine.
Good morning to all of you and welcome. I'm here because this report is so important to all of us who are either in the field of education, in the field of medicine, but importantly, in any field, that the proper way of educating and caring for our children is so very important. And so on such short notice, you know this came together in a very short time, I said, I want to be here. I don't go to every single one of press release or briefing release, but this one I think is particularly important. So thank you for being here. And on the messaging of this report called Transforming the Workforce for Children Birth to 8. You all know that Institute of Medicine and National Research Council have a strong history in this very important area of child development and the education of children in the early childhood and early elementary years. You know, the past work that the IOM and NRC has conducted included landmark reports, Neurons to Neighborhood, and reports on early childhood assessment, mathematics learning in early childhood, among many, many others. So I think the report we presented today builds on that whole body of work, and of course, work in many other fields, but move forward, I believe, in a very important direction. I think all of you know that the science in this field shows that children begin learning at birth, and they develop at a rapid, cumulative pace in the early years. I have a 2.5-year-old grandchild, and of course, she's the smartest on earth, right? And I won't pull out any pictures to show you, but as I watch her getting smarter every time I see her, which is quite frequent, I'm just not surprised by the science that's behind this and the science that speaks to this. We all know that children need secure and consistent relationship with adults during these years. However, as Birth to 8 report being released notes, the complicated landscape for children from birth through 8 interferes with this consistency. These children receive services in many different settings and interact with a wide range of adults in different roles. The landscape for the professionals who provide their care and education from infancy through early elementary school can be diffuse and often disjointed. As is often the case, the policies and structures are lagging far behind the science and current knowledge of what we know that we should be doing. The report brings in important focus on what the science of child development tells us, not just about children, but about adults who work with children, and what they need to know and be able to do, and how they need to work together and supported by systems to ensure they are providing children with a continuity of good care and education. The professionals who do this important and sophisticated work represent one of the most important ways, I believe, to make sure that children have high quality, consistent support for their development and learning as they grow up. However, our current system doesn't reflect the importance of their work, and they don't currently ensure that different types of professionals share a core set of knowledge and skills. I think this report envisions how the system can support professional learning, workforce development can be transformed to reflect a more unified approach. And I think that's really, really important. It offers concrete suggestions for action at local, state, and the national levels in areas of higher education. And of course, professional learning during ongoing practice, policies for qualification requirements, and other standards of professional practice are being recommended in this report. I'm so excited to see the release of this report. I've been waiting for a while. I've heard about the recommendations, and I really believe that this report is going to be transformative. And I hope it spurs a drastic turning point in how we care for young children. For too long, our country has been settling for status quo rather than envisioning the systems and policies that are needed and committing to strategies necessary to achieve them. And finally, this report has set forth this vision. And although it will take years to fully implement, and I told Kimber and the staff, I said, when I hear this is going to be a long haul. I think all of us are committed to see it happen. It will produce substantive changes to build and sustain a stronger foundation to provide high quality, consistent early learning opportunities to children as they grow up. So I want to really commend the committee and the staff for doing such a great job. This is, in fact, in my mind, truly a transformative report. I want to make sure that we recognize the supporters. Here we go, the study supporters. As you can see there, Department of Education, Department of Health and Human Services, represented by the Administration for Children and Families, and the Health Resources and Service Administration, Bill and Melinda Gates Foundation, David and Lucille Packard Foundation, the Robert McCormick Foundation, and the Kellogg Foundation. Of course, I'd like to recognize the contribution of our staff to this project. Bridget Kelly was study director, and she worked tirelessly on this project, assisted by Sheila Motes, Wendy Keenan, Sarah Tracy, and Alison Berger. The study was done under the auspices of the Board on Children, Youth, and Families, directed by our own Kimber Bogart. And finally, we're grateful to the committee who dedicated their time and expertise as volunteers to carry out this work. The committee is represented here today in person by LaRue Allen, who's chair, and Jacqueline Jones and Albert Watt. Now, so I'd like to say, first of all, a word of personal thanks to all of them. I know how much work you have to put into this and how, I would say, visionary you've been, how we're cobbling all the pieces together to see a pathway going forward. LaRue Allen is the Raymond Roslev Weiss Professor of Applied Psychology and Chair of the Department of Applied Psychology in the Steinhardt School of Culture, Education, and Human Development in New York University, where she also directs the Child and Family Policy Center. Jacqueline Jones is the President and CEO of the Foundation for Child Development, and Albert Watt is a Senior Policy Analyst in the Education Division of the National Governors Association. And I thank you all again and look forward to a great report, the messaging, and LaRue will actually present an overview of the report messages, followed by Jacqueline and Albert. Thank you very much indeed. Thank you.
Good morning, everyone. We appreciate your joining us here as well as in cyberspace. I understand there are hundreds of you out there. Don't make too much noise, it'll be distracting. We're delighted to see that we have registrants from across the country and many different roles and sectors. We have researchers, we have educators, we have people from higher education, we have program coordinators, health practitioners, people from government, from foundations, from nonprofits, and many, many more. We also know that several of our fellow committee members are out there in cyberspace, and we have one who took the time to join us here today. So I want to say thank you, and I miss you all. I'm talking today about our report, which is entitled Transforming the Workforce for Children Birth Through Age 8, a Unifying Foundation. The statement of task, which ran to 2 pages, can be summarized briefly as, how can the science of children's health, learning, and development inform how the workforce supports children from birth through age 8? Thank you to our sponsors, and thank you committee members. And I want to remind all of you that those of us who serve on the committee serve as individuals and don't represent our particular organizations. So the study process, which evolved for this committee over a 20-month period. The study is defined, the committee is selected and approved, and you wouldn't believe how much effort goes into selecting the appropriate members for the committee. There are committee meetings. We had 5 in-person meetings, several teleconferences. We collected data via several different sources, whether it was document review of published and unpublished works. We held public sessions in connection with each of our meetings, where we invited hundreds of people to join us in person and on the web to offer their perspectives on the issues that we were considering for that particular meeting. We conducted site visits to 3 different cities in different parts of the country, wanting to see best practices and responses to challenges as people were engaging with the tasks that we think are important for realizing the vision that we describe in this report. And we had a group of practitioner advisors we found very important for helping us to stay grounded between the theory and the science of child development and what really happens on the ground as you implement that science. So thank you to our practitioner advisors. Let me start with our key messages, the first of which are, of course, very familiar to you all. Children are already learning at birth. Development and learning in the early years is rapid and cumulative, and it is, of course, the foundation for lifelong progress. The next message is where the committee's focus begins. Adults who provide for the care and education of children birth through age 8 bear a great responsibility for their health, their development, and their learning. And just when consistent, continuous support is so important, we find that the systems that support children and the adults who work with them, those systems are fragmented. Practices and policies have often not kept pace with what we actually know about child development and the competencies that are required to provide high-quality care and education for children birth through 8. High-quality practice requires more than just the individual mastery of competencies. So you'll have the opportunity to digest this graphic at your leisure, but let me guide you through it quickly. There are many factors that contribute to quality practice, starting with the science that's across the top of the figure. The science contributes to professional learning supports, and then the second area of green points you toward the knowledge and competencies of practitioners, of leaders and administrators, and of a quality practice environment. All of those things contribute to the well-being of the practitioner. We hope that all of those things working in synchrony will then lead to a workforce that can engage in high-quality relationships and interactions with families, with children, and with other professionals. And all of that hard work will lead to the kind of child outcomes that we so want and so deserve. For creating optimal child outcomes, Our vision is a care and education workforce for children birth through 8 that is unified by a foundation of the science of child development and early learning, shared knowledge and competencies, and principles to support quality professional practice at the individual, setting, systems, and policy levels. As a result of this vision being enacted, all children would experience high quality and continuity in support for their development and early learning. We have another beautiful graphic for you to digest at your leisure that summarizes the committee's 13 recommendations. Starting on the far left with the green, you see the focus on the 2 circular arrows that indicate the importance of change at the local, state, and national levels happening in synchrony and in coordination. The blue block in the middle points to the integration of interprofessional practice and learning through requirements for qualifications that are consistent across the birth to 8 age range and that reflect the science as we know it. The important role of higher education in making sure that those who come into the field and those who are already in the field get the educational support that they need for an interdisciplinary, field experience-based education. Once professionals are in the field, they need learning ongoing during their practice, and we need systems that support integration both horizontally, that is, those who work with 4-year-olds need to know something about 3-year-olds and 2-year-olds and 8-year-olds as well, and vertically, we want to make sure that across the systems of health, social services, and education and care, there's regular opportunities for practitioners to interact and learn from one another. Evaluation and performance for continuous improvement means that we need systems that monitor progress and pay attention to the extent to which ongoing achievements in science mean that we need to improve the extent to which, the ways in which we support ongoing professional development. Most important, and we call it out here with the bar of blue on the far right, leadership in the provision of services for children 0 to 8 needs to be as well informed about the science of child development as anyone else so that they can support their workforce who provide the on-the-ground work. There need to be coherent funding, policies, guidance, and standards. We need support for implementation of all of the work that's going to be necessary in order to realize this ambitious vision, and we need to improve the knowledge base that exists about who the professionals are and what their needs are in an ongoing way to improve themselves and do the very best that they can interpreting the science of child development into practice with actual children. Our unifying foundation is made up of the essential features of child development and early learning, and the principles to support quality professional practice. So you know a lot of these things already in terms of the essential features of child development. Children are already learning actively at birth. Their development consists of many important and interrelated components, including cognitive development, social emotional development, physical development, mental health, and health development. These are overlapping and mutually influencing areas of development. We want to acknowledge the importance of our recognition that strength and adversity experienced by children can undermine development in all of these areas. To further support optimal child development, secure and responsive relationships with adults coupled with high-quality positive learning environments are foundational for the healthy development of all young children. Conversely, adults who are themselves underinformed, underprepared, or subject to chronic stress may contribute to children's experiences of adversity. But who are these professionals? Well, they enter the field, down at the bottom band of green, they enter the field from many different areas, including high school graduation. They could be practicing care and education professionals. They could be training to become health and social service professionals, and so on. And we focus at the top on professionals who work with children, all professionals who work with children from birth to age 8, including, just to call out a few, head teachers in a classroom, family daycare teachers, directors of infant toddler centers, principals of elementary schools. And what do these professionals need in order to support quality practice? Well, they need foundational and specific competencies that come from this so important science of child development. They need to be able to work with diverse populations, and you know we mean diverse from many different perspectives. Professional learning systems need to develop in order to sustain professional competencies and, in fact, help them grow in their professions. Practice environments need to enable high-quality practice. It's not enough for the individual to be competent. We need competent workplaces to support them. Systems and policies need to align with the aims of high-quality practice, and professional practice systems and policies need to be adaptive because the world is always changing. So here are our recommendations in brief. And I refer you to the downloadable report for more detail. Especially you should look at Chapter 12. Strengthen competency-based qualification requirements for all care and education professionals working with children from birth through age 8. Related to that, develop and implement comprehensive pathways and multi-year timelines for transitioning to a minimum bachelor's degree qualification requirement with specialized knowledge and competencies, not just any bachelor's degree, but a bachelor's degree that incorporates what we know is important in helping children birth to 8 develop optimally. And this for all lead educators working with children from birth through 8. This will be implemented over time, clearly. The recommendations implementation will need to be tailored to local circumstances and implemented in the context of efforts to address other interrelated factors. And here is a graphic demonstrating the other interrelated factors necessary to implement this bachelor's degree expectation and qualification requirement. Just to take one gear to focus your attention on the far right, second from the bottom, we have access to degree programs. So access to degree programs is quite uneven across the country, and individuals need time to access opportunities. They need the funds. They need support for academic success. That, in the context of work environment, supportive leadership, governance, et cetera, will need to be put into place in order for us to realize this ambitious vision. So clearly, higher education has a role to play in helping us realize this vision. We need to develop and enhance programs in higher education for care and education professionals through requirements for coursework and, most importantly, field-based learning before the degree is conferred, partnerships with local practice communities, and cross-institutional relationships so that those who work with children from birth to 8, whether they're training in health or in social services or in education and care, have the opportunity to interact with and learn from one another. We need to build an interdisciplinary foundation in higher education for those other professions, including a core of requirements in preparation for professional roles, whether it's in social services, education, and health and allied professions. Once in the field, there's a very significant need for well-thought-out, ongoing professional learning for continuous improvement. We want to support consistent quality, coherence, and availability of professional learning supports during ongoing practice for these professionals. And related to that, we want to develop a new paradigm for evaluation and assessment of professional practice so that evaluation and assessment leads to more development of ongoing learning opportunities and vice versa. We find that Current practice focuses on a narrow set of children's domains of competence. We would like for there to be attention to a broader range of competencies among children, and in addition, we need to pay attention to the knowledge and competencies among those in the workforce themselves. The leadership in organizations that support the development of children birth to 8 is vital, and it's necessary that they be as well informed about how the science of child development should inform their practice as anyone that they're hiring or supervising. So for early care and education leaders, we want to strengthen instructional leadership as a core competency. And for principals, we want to better integrate early learning principles and best practices throughout the principal development pipeline, so that they know as much about birth to 8 as they do about 9 to 15. We want there to be specific mechanisms for the support of interprofessional practice, particularly for children birth to 8, the collaborations among healthcare workers, social services, and the care and education service sector, vital for the optimal development of children. There are many strategies that we can develop to support this interprofessional collaboration, including things like sharing and interpretation of information and creation of learning communities that integrate practitioners across the birth to 8 span, as well as across professions. We want particular emphasis to be placed on strengthening the linkages and consultation that support children's mental health. And here you can see that the need for health, social services, and mental health to collaborate with the care and education sectors is vital. With this ambitious vision, clearly we need support for the implementation of the various oiling of the gears that will be necessary to make it happen over the years. Collaboratively develop and periodically update coherent national guidance so that state and local efforts can be supported and sustained. We believe that in order to model this kind of integration of levels of care for children, levels of policy care and implementation, it's important to jointly fund, public-private, state or local coalitions that will undertake model 10-year initiatives. And this would be to assess where we are right now. We found in our site visiting that there were a lot of very interesting creative things going on in the country that don't get disseminated and so aren't reflected in current practice across the country. Envision how we implement the goals and recommendations of the report, and think about how we set in place mechanisms for continually examining where we are and where we need to go. This report is a call to action. It calls for a commitment to the pathways that will lead us to the systems and policies that we need, rather than making do with the systems that we have. We know, the committee knows, that this is not going to be a fast, easy, or cheap fix. It will require a strategic, progressive trajectory to transform the professional landscape, accompanied by significant commitment. All of us have a stake in the development of children birth to 8, and all of us will be called upon in one way or another to help realize this vision. The alternative is the status quo, which is simply unacceptable. The status quo is going to perpetuate today's fragmented approach, resulting in less than adequate support for children's development and learning, and we know we want better than that. Finally, the committee anticipates that these actions will transform the workforce. We want to elevate the perception of the professionals who work with children from birth to 8. They are all professionals. We want the public at large, as well as those in other professions, to recognize the complex and important role that they play and the challenging nature of the work they do. We want it to be recognized that they require support for ongoing learning and development in order to be successful. We want to be able to recruit and retain high-quality workforce and retain the workforce that we currently have as they continue to develop their skills and competencies. And as a result of all of this envisioning and implementation, we want to get things right from the very beginning for all children, laying the foundation for their lifelong progress. Thank you.
Now I'll begin with our question and answer session. So for people in the room, if you have questions, please go up to one of the two microphones, and then people submitting questions from the web, please go ahead and do that. I will just get us started off. So first question, are there any, you presented 13 recommendations. Are there any short or easy wins among them?
Well, first of all, I just mentioned that there is knowledge available. There are practices that are going on in parts of the country that aren't being recognized for their innovation, their creativity, the extent to which they do integrate across disciplines, for instance. So the idea that we would develop ways of communicating what's happening now is already a win. I think it's possible that institutions of higher education can immediately take a look at their curricula, take a look at the possibility for partnerships with other institutions of higher education so that they can start paying attention to the need for a field-based and curriculum-based approach to training in an interdisciplinary way the professionals that we need. Do you have other thoughts, colleagues?
I think the major highlight for us was the notion of the science of early learning, and to take a look at the policies and practices that are being implemented across the country is tremendously important, but as long as it's grounded in the science. And so for folks to review those policies and practices, always looking at the science of early learning was something very important to the committee. That's something that can be done right away.
We have a question. Please introduce yourself.
How would these recommendations play out, in particular the bachelor's degree, for child care centers that are home-based or in churches?
So it's definitely going to be, as LaRue mentioned, a lot of these recommendations it's going to take some time and effort. The transition to the bachelor's degree for all sectors, but to some of these more challenging sectors, is going to require multi-year, multi-level, and multi-sector approach. So what we recommend in the report is that at the state level, the local level, and the community level, we get the stakeholders in place. So that could include definitely higher education institutions, perhaps state policy leaders who have influence over the licensing structure of professionals and accreditation programs for teacher preparation programs, and of course the early care and education programs and leaders, to develop a strategy that really looks kind of tailored to their community, looking at the supply of higher education programs in the community to think about, do we have the capacity to get more people into these programs? And a lot of these professionals are going to be non-traditional college students or post-secondary students who might need, scholarships and grants and supports throughout their tenure in the college to attain their degrees. That kind of group can also look at the local demographics. Some communities may already have a lot of professionals who are very close to the bachelors or who already have bachelors, but some communities they're going to be hard to find some of those candidates. So looking at those local demographics and what needs to be done to sort of work on the pipeline earlier on to sort of support this transition to the BA. So it's going to be, we think the communities need to come together to look at all those perspectives and to look at the data and the capacity they have, and then think about what the best strategy for that context is.
Good morning. My name is Kevin Briscoe. I'm with the Council for Professional Recognition. And my question starts with this. At the center of your recommendation is a minimum having a bachelor's degree. But we found out that fewer universities are actually offering an early childhood degree. And we've also found that degrees without the experience or the demonstrated practical competencies may still result in that knowledge gap, which will obviously affect the expected outcome. So my question is there a place in this recommended model where our child development associate credentialing program is there a place for it in this model? Because we believe that's actually the crossroads where experience and education meet. So if you could speak to that a little bit, I'd appreciate it.
The committee thought very long and hard and read a good deal around what we know about a bachelor's degree. And certainly the evidence is inconclusive. However, we're very concerned, the committee was very concerned that individuals have the competences they need to do the work. And so it's not just any BA. It is tremendously important that it's a BA that has undergirding in development, but also that it is accompanied by those competencies. So your question specifically is about the entry-level certification for teachers. And we certainly, as you can see, you'll see in our recommendations, think that there is a place, and in this sort of tiered system, there is a place for entry-level work. There is a place to proceed from novice to expert, and so we see a progression of skills. But we are saying that for lead teachers in settings, that the bachelor's degree and the competencies they need to do the work are really important, and we think that that is an appropriate stance. It does not preclude in any way a CDA as coming in as an entry-level certification. Colleagues?
I would just add that our rationale for that recommendation is also acknowledging that we need to build a future workforce, transforming the workforce for the future, where we know that the science is only going to get more complex and more sophisticated. Our knowledge about child development research is going to only get more sophisticated, and that if we really want a workforce that can keep up with that research and can really harness all that knowledge and apply it on a day-to-day basis in the classroom or whatever setting the profession happens to be in, that we need professionals who have the college education as a foundation, as sort of a foundation knowledge as they enter into the profession.
I would just add that we want those who work with children birth to 8 to get the respect that they deserve, because the work they do is vital, of course. We want them to be able to reflect the competencies that are necessary in order to do that work, and we want them to have the education that allows them to compete with those who work with children older for the kinds of rewards that come with good professional accomplishment.
And I have one more thing to add. As you could see from the diagram with the tree, there are multiple entry points into this field. Folks come in, they have a BA in some other area, they now want to engage in early childhood education, they come in, they want to have a CDA. So I think what we are looking at is a field with multiple entry points, and we're trying to support all of those folks who want to come into the field at different levels, but to make sure that they have a core body of knowledge that represents what we think are important. It's important for child development and for being a lead teacher in a classroom. Yeah.
Next question.
Hi, my name is Bryce. I'm with NEFCC. And my question was just, how does the institution recognize the respect that educators deserve after they obtain their educational degree? A lot of times, some of my friends will go to Teach to America, but find that they don't have the resources to sustain a successful life financially. And so although it is encouraged to get a BA, how can we make sure that policymakers recognize the need for income for people that took the time to have that education?
We were specifically not charged with considering the financial implications of our Blue Sky recommendations. At the same time, note that I indicated we want those who work with children birth to 8 to be on par with those who work with older children. So clearly, we're talking about being able to attract the same kinds of benefits and recognition, financial and other, that those who work with older children currently receive.
And that is one of the impetus for the college education minimum requirement. We felt that, without that, early care and education, especially for those people who work with kids before kindergarten, are always going to be considered less than elementary school teachers, middle school teachers, and high school teachers, and that really will perpetuate sort of the justification of funding levels, of the expectations in terms of programs and professionals, and in terms of pay. And so, it's not the only reason we have that recommendation, but it is definitely one of the rationales for it.
Hi, Patty Cole from 0 to 3, and thank you so much for all the work on this report. I look forward to being able to download it and read it. So my question has to do with, so we're really very grateful that you're including infants and toddlers and the recommendation that ultimately there should be a minimum BA requirement for working with young children, and we know that this is the segment of the early childhood that has the furthest to go, both in creating the understanding of why people who care for babies need to know what they're doing, and also the pathway to get there. So those are really my two questions of how do you are you making the case in the report for this really highly competent workforce for infants and toddlers, and what's the pathway for getting there?
We absolutely know that your constituents will have the longest road to take. We include them in the professionalization of all of those who work with children from birth to 8, acknowledging that the kinds of 10-year local coalitions that would assess what's happening and what needs to happen would be charged with figuring out, as Albert just said, what resources do we have? What resources do we need? Is there distance education available that can help someone who's working with infants take one course a semester until she makes it to the point where she has enough for the associate's degree, and then so on and so forth? We recognize that this is not an easy lift, but it's important enough so that we think there ought to be national attention drawn to realizing the goal, and all of us have to work together to figure out how to realize it. Higher education has to get more flexible and more creative. Workplaces have to develop the skill to make the time, help with resources, and so on.
Question?
Hi, Adele Robinson, and I'm here in a private capacity. I'm really pleased to see that this extended through age 8, and I wonder if in the section on continuous improvement you address the controversy of teacher evaluation based on child assessment that is going on, and if you had a quicker than 10-year fix recommendation.
Not sure about that last part, but so yes, we discussed that, and there is a part of the report that addresses that issue. Our concern with the current sort of direction and where teacher evaluation is going is, so now we're talking mostly in the public school system, is that there's a danger of it being sort of capturing a too narrow view of what effectiveness means and missing certain best practices and behaviors that should be fostered and recognized through a teacher evaluation and professional development system. So part of that is the assessment issue. We understand that the data about how kids are developing and learning should be part of the, again, evaluation and support system for teachers. We are concerned that at this point, there seems to be a focus on very narrow measures of that. So we think that the policies and systems need to be more comprehensive in the child data. We also have some thoughts about the observation piece. For the most part, the observation tools that are being used in schools are developed with older kids in mind, and we think that there needs to be some thought paid to how those observation tools can be adapted to younger children or develop new tools that address younger children. And many states are actually doing this already. And there's another component that we felt was kind of missing in our research, read-over research and through our site visits. We saw how important it is for teachers to engage with families and with other professionals, whether it's health professionals, mental health specialists, et cetera, and how all that contributes to learning and growth in their students. And those kind of components are not paid attention to as strongly as the other parts. So we felt like that could be beefed up as well. So the assessment issue, we didn't make any conclusions about, how much weight it should have and all that kind of stuff. But we realized that it's a part of the, it makes sense to look at how teachers are doing through that lens. But it always has to be tied to how that data about student assessment is linked to improvement of practice and professional development later on.
I just wanted to add, the committee felt that the evaluation of teachers is complicated, as Albert has said, but that it should be seen in context. And so the notion of the resources that teachers are supplied with, the level of training, something that should also come into play as one looked at teacher evaluation.
We have a question from the web.
Yes, this is similar to what's been asked earlier. The system you described is likely to exclude diverse populations who work with children and have not historically had access to higher education. Did the committee discuss stackable credentials?
Discuss what credentials?
Stackable credentials?
Yeah. One of the things the committee was very concerned with is that we maintain the diversity of the communities and that reflect the children with whom we're working. So we recognize that this is a long-term event and that it is important. So yes, there are levels of training that we see as a kind of pathway to expert professional development. And so we thought a lot in this committee about the kind of ongoing professional training, the kind of teacher preparation that would lead to levels of professional status. And so there are, as I said before, there are multiple entry points and people will move along a pathway. We have thought about at the local level, ways in which, as we've mentioned this a couple of times, we would look at what is going on at a local level, look at the kind of opportunities there are, and the kinds of career pathways that there are at local levels with degrees that lead to a bachelor's degree. So there is opportunity for everyone in our model, we think, to be able to reach the status of a lead teacher.
We also talked about the need for better articulation policies between 2-year and 4-year institutions. So if those people who have associate's degree can attain a bachelor's degree easier. I think the bottom line is that this requirement or this recommendation for a bachelor's requirement as a minimum has to be accompanied by a robust strategy for maintaining and growing the diversity of the workforce, whether that's through scholarships and grants, whether that's through support system within the higher education institution so that those people who enter the degree program can actually complete it. Access, there are some communities where it might be hard for people to go into a class after they work. So all those issues need to be taken into consideration but we think that, again, it's going back to the science that we absolutely want this to be the future of the workforce, that this foundation needs to be the future.
I had one more question from the web. The person wanted you to say more about compensation for early care and education providers.
I can't say a lot more because it wasn't a part of the scope of work of our committee to talk about. We weren't constituted with the necessary professionals in order to do that job thoroughly. Considering the scope of work that we had, we didn't have labor economists, we weren't impaneled to talk about compensation in a lot of detail. I have acknowledged that our recommendations about the credentials necessary that we want to be minimal for working with those birth to 8 were in part crafted with an eye toward professionalizing those who work with this age group so they are regarded no differently than those who work with 10-year-olds, for instance. But we weren't charged with working on the specifics of financing. That will come later, and we do have some recommendations about how coalitions of local and regional coalitions can work on figuring out how to more creatively use the resources that are currently available, for instance.
Do we have another question?
Good morning. I'm Joshua Sparrow. I'm from the Brazelton Touchpoint Center, and I also wanted to add my thanks for your work and also my appreciation for extending to age 8, and I'm sure there are many who hope that this will create another opportunity to strengthen the dialogue and collaboration between the early childhood and K through 12 workforces. And I'm curious, on the other end, what your thinking was about starting at birth rather than starting with pregnancy, because science has also shown us for the past couple of decades that learning actually begins at least in the 3rd trimester of pregnancy. And there, too, there would be an opportunity to increase collaboration across sectors and across disciplines. And so the issue of pregnancy rather than birth gets to the question I have, which is, did you look at all at competencies for working with parents and families, because that's another potential silo in both the early childhood world as well as K through 12 as well as in pediatric health care?
Thank you for your questions. We had an enormous scope of work, which meant that while many of us acknowledged the importance of differential experiences and outcomes of pregnancy contributing to, of course, what happens at birth, there were 19 of us, which is a very large committee already. We just were not impaneled to be able to consider what could be another whole committee report. Yes, family engagement, the acknowledgement of the importance of family engagement as a core competency is something that we talk about, but you'll note that there is a committee on supporting the parents of young children that's working right now to really focus on the skills and competencies that are needed in that area.
But it is mentioned as a competency in the report.
Yep. Thank you.
Hi, Sue Young-Oh. I'm with AFSCME, the American Federation of State, County, and Municipal Employees. We're a public sector union that represents child care providers across the country. So I'm also looking forward to, diving deeper into this report. I also came in like 20 minutes late. So I don't know if you had discussed this earlier, but was the committee impaneled? I've never heard that word. Impaneled to look at, other than, achieving a bachelor's degree, what would be the mechanisms for which to, as you said, raise the level of respect for this early care and education workforce from birth to 8? That's my first question. The second question, well, actually, can you answer the first question while I think about how to ask the second question? Sorry.
Albert is going to answer the question, but let me say that getting to the bachelor's degree was through a process of looking at what the science tells us about how to support children's development and realizing the competencies necessary in order to support that development. So it isn't as though we looked at the bachelor's degree as sort of a magic solution to all of our problems, but rather, what does one need to know in order to really be able to work effectively with children?
And before Albert answers, it's not any bachelor's degree. It is a bachelor's degree that really relates to early development and the competencies. So it's BA and the competencies that one needs to be able to lead young children to be successful. Okay, now you can answer.
So just so I understand the question, your question was about what else did we have anything else that can elevate the profession for early care and education
Correct.
providers? So I think, so again, I think the message behind this report is that early care and education providers, whether they are in the birth to 5 arena or the K-3 arena, have almost identical goals in terms of supporting children's learning and development. Their jobs are undergirded by the same science, which tells us that it's a highly complex, process, and it takes a sophisticated workforce to be successful. Our hope, I guess, is that, again, through the kind of the local coalitions and that, the sort of the multi-level coalitions that we talked about in our report, that by looking at the science, by looking at comparing the science and what policies they have in place and what programs they have in place to support the professionals in this field, that that really policymakers need to come to terms with, how they need to support the professionals so that we get the outcomes that we all want for kids and for the adults. So we don't have a sort of a political strategy. I don't know if that's kind of what you're looking for to sort of raise that profile of the professions. But I think that's it's more of a process that we are hoping that this report will kick off.
And I think that kind of gets to my second question, which is, right, there's the political strategy of all this, and I was wondering what the IOM and NRC might be doing in terms of follow-up to releasing this report. Because sometimes, right, if you give a state policymaker, for example, a list of 13 recommendations and say that the number 1 be, for example, recommend that at minimum, the early care and education workforce. So not necessarily, I guess, I don't know if there's how you would parse the difference between folks who are child care providers versus, maybe like a pre-K teacher or a K-3 teacher. But so again, you give a state policymaker 13 recommendations, the first being minimum of a BA degree that is relevant to early childhood care and education. And then there's these other things, right? And so then to help the workforce get there, you need scholarships. You would want to give folks a time off that they can actually continue working while getting these degrees, maybe stackable credentials, et cetera. They're just going to go with, oh, well, okay, number 1, we'll just do the minimum. We'll do this BA and not worry about the rest. I guess I was just curious how you were thinking about that, or if that's just really not something you have to think of because it's not part of your empanelment.
I'm sorry, I created that anomaly. You will find in the 500-plus pages of the report a lot of attention to implementation, because we knew that our recommendations were very ambitious, and we knew that after working all those months to synthesize and analyze data and come up with the recommendations, we didn't want them to just disappear. And so you'll find that the Academy and the sponsors will work together to think about how to move forward. But clearly, we include recommendations like local and regional coalitions to really think about what is and what needs to be, and we're very serious about the need for these coalitions to work together to figure out a strategy so that precisely what you fear will not happen, that there will be an integrated approach to figuring out how to move on several fronts at once.
So very specifically, Chapter 11, recommendations 11 and 12 will probably answer your question. The committee was very clear that to accomplish these goals, that there had to be significant work at both the national level and, as LaRue has said, at the local level. So there were recommendations for non-government agencies that really support the early childhood workforce to come together to define a set of standards and to review those standards and make sure they're aligned to child development. There are also recommendations around the ways in which federal agencies can work together with non-federal agencies to really support in all of their programs and policies recommendations for the workforce that are, again, aligned with the science, as well as coalitions at the local level. So 11 and 12, Chapter 12.
I apologize, that is all the time we have today for questions. But I want to offer a special thank you to our committee members for being here today. As you heard, they were representing the diverse expertise of the entire committee that wrote the report. And as a reminder again, you can download the report and related materials at www.iom.edu/birth28. Thanks again for joining us, and have a great afternoon.